Hello all, I'm Dr. Om Prakash Jamada. I'm working as consultant pediatrics and neonatology at Apollo Hospital, Navi Mumbai. Today we are going to talk about neonatal intensive care unit. We call it NICU as a short form. So let's try to understand first of all what is neonate. A baby who is less than 30 days of life is called as a neonate. There are many reasons for the babies to come to NICU. So we'll try to focus on the common reasons why they come to NICU after birth. So we know all prematurity is the leading cause of morbidity, mortality all over the world. And in India, it is the commonest reason for babies coming to the NICU. So that is one. Second is full-term babies coming to the NICU with difficulties in breathing. And there are other multiple reasons like jaundice, low sugars, low calciums. These are the set of babies who come to the NICU. So let's first of all talk about what is preterm babies and prematurities. So any baby born before their expected date of delivery is called as preterm. But that doesn't mean that all preterm babies need NICU admission. Particularly babies who are born less than 34 weeks or less than 2 kgs at the time of birth need NICU care. The reason behind that is their ability to maintain temperature, their ability to tolerate feeding, oral feeding, breastfeeding is less. That is the reason they need care in the NICU, where we make sure their temperature is very well controlled with the use of warmers, incubators, and we make sure they are fed on a regular basis. If required, they are giving IV foods. So out of these preterm babies, we focus more in the extremely preterm babies. Now these are the babies who are born less than 30 weeks or less than 1 kg babies. At Apollo Hospital, we have got an advanced neonatal care unit where we get most of these extreme preterm babies who require breathing support at the time of birth, and they require long stay in the NICU. We have got some babies who are as small as 500, 600 grams who stayed with us for almost like 2 months, 3 months based on the difficulties that they face. And I'm very proud to tell you here that Apollo Hospital have a very good outcomes comparable to the international standards of care that we get outside India. So we look for the intact survival. Intact survival means it is not just the survival of the baby, but a neurodevelopmentally normal outcome. That is what we look at Apollo Hospital NICU. And I'm very happy to share with you that we have had a very good outcomes comparable to the international standards. So these babies require breathing support at the time of birth. They do require nutrition that baby is supposed to get from mother's womb. From outside, we try to give them carbohydrates, proteins, fats, as well as different different nutrient supplements like calcium, phosphorus, sodium. All these things are given from outside for all these babies. These babies are prone to get high risk of infections, and in fact that is the commonest cause of death in these babies. So here in our NICU, we take all aseptic precautions. We try to maintain 1:1 nursing as to baby ratio so that the risk of infection, the risk of cross infection from one baby to other babies are decreased. Also, we involve parents actively in the care of baby. That helps a lot for the parents also to be part of the team in the treatment of the baby. Now, active involvement of parent is not just every day we update the parents about the condition of the baby, but also we ask them to visit the baby in the NICU. Mother as well as baby can sit down with the baby. They can hold the baby to their chest, which is called as a kangaroo mother care or kangaroo father care, where the warmth of the mother is exchanged with the baby. It is not just the warmth, but also it gives fighting capacity for the baby to recover faster from the NICU. And the same is continued after discharge to home also. This gives a lot of confidence to the mother, as well as this helps them to recover faster from the stress that they go through during the care of baby in the NICU. So this is what it gives us the outcome in terms of the intact outcome, what I said earlier. This helps the baby neurodevelopmentally also to get a direct skin to skin contact, as well as this helps the mother to get emotionally bonded with the baby. So this is about the extreme preterm babies. Now the second set we thought we will discuss about the term babies who require NICU care. Now, some of the full-term babies who are like more than 2.5 kgs, around 38-40 weeks of life, they do also develop breathing difficulty at the time of birth. Most of the time, the reason being baby passes motion in the mother's womb and then that motions are gone into the breathing pipe. So we call it as meconium aspiration syndrome. It's not just the aspiration of the meconium, but the consequences of aspiration of meconium in terms of having pneumonias, having high pressures in the lungs, we call it as a pulmonary hypertension, that causes difficulty in breathing to these babies. So PPHN or high pulmonary pressures are very dangerous. We have seen babies who are fine at the time of birth, develop respiratory distress, difficulty in breathing, and then they require intensive care in terms of the ventilation and medications to decrease the pulmonary pressure. I must mention here the gold standard of care for management of PPHN is inhaled nitric oxide and high frequency ventilation. And at Apollo Hospital, we have got both of this, and that's the reason we have got a very good outcome for these babies having pulmonary hypertension. So we have got a bedside 2D echo which guides us how are the pulmonary pressures. We have got a continuous invasive monitoring of blood pressures as well as the ABGs which are done on a routine basis for these babies, which helps us to decide the plan of treatment in terms of when to start the high frequency ventilation, when to go for inhaled nitric oxide, and timely interventions gives us good result. That is what I say, like we are very fortunate in Navi Mumbai area that we have at Apollo Hospital NICU, which helps us a lot. With the team efforts, we can have good outcomes for bad pulmonary hypertension also. Now, coming down to the third category of babies who may need NICU care are the babies who have got a jaundice. I'm sure many of us have seen babies developing jaundice. Not all jaundice needs phototherapy. Jaundice levels which are high can cause problem to the baby, needs phototherapy. So based on the day of life for the baby, based on the maturity of the baby, the level of jaundice is decided whether it is a normal jaundice or it is a high jaundice. And if the bilirubin levels, the jaundice levels are on a higher side, these babies we observe in the NICU setting under certain lights are there. There are certain wave frequency lights are there which helps us to decrease the jaundice. So these are the third set of babies. There are other causes for babies to coming to the NICU, that some baby having difficulty for feeding, they are not able to latch well at the mother's breast, or they are not taking feeds orally. They may have got an infection, or they may have got a low sugars, low calcium. So these are some other causes of babies coming to the NICU. In COVID times, I would like to mention here that we have got almost 100 mothers who are COVID positive, and these mothers delivered babies in Apollo Hospital. In the first wave, most of these mothers as well as babies were relatively stable. We did screening tests for the babies after birth, and none of them were turned to be COVID positive. However, in second wave, we have seen mothers coming with a very sick, critical situation, and the babies are born extremely early, like they are born at less than 30 weeks of age. So second wave of COVID has affected babies also badly, and these babies require longer stay of hospital, longer duration of ventilation. They have got difficulties in not only breathing, but also they have got difficulties for feeding. The feed tolerating ability of this baby was also specifically compromised. And now we are seeing MISN, which is multisystem inflammatory syndrome in neonates. I'm sure many of us are aware of the third wave, what we are looking in the pediatric population. The similar third wave is affecting the newborn babies also. So we are very much keen to observe the babies who are born to COVID positive mother, and we do routine screening for these babies for not only COVID, acute COVID infection, but also we do the antibody titers to see whether baby has got some inflammation that is coming from the mother to the baby, and that can cause difficulties for these babies in terms of cardiac dysfunction or breathing difficulties or feeding difficulties. So to summarize, what we have tried to cover is the reasons for coming babies to the NICU is: one is preterm babies, second is full-term babies requiring breathing support, Next is jaundice babies or babies having low sugar, feeding difficulties or infection, and COVID positive mothers babies. So these are the set of babies that we commonly see in NICU. There are multiple reasons, but this is what I wanted to tell you, that common conditions and common situations that we face in NICU. I would like to mention here that the teamwork makes a lot of difference in terms of the neonatal care, and the nurses are the pillars of this team, and their support and help and continuous, they are like second mothers for these babies. Because of them only it is all possible to have good outcomes in the neonatal care unit. Thank you very much.